river edges and it has these flowers. It often looks like parsley. And if a cow would eat these plants, then they would suffer with convulsions and die. The US FDA rates cicuta virosa as a highly toxic plant. Okay, it's a highly toxic plant. I mean, a human being, if accidentally ingests cicuta, can die within 48 hours after suffering convulsions. So that's how poisonous this plant is. So it's important to know a little bit about the history of these plants. And it belongs, interestingly, and this is something I found out very recently, to the family of carrots. The entire family from where these plants come, Conaium, cicuta, they all come from the carrot family. And they're related to our Indian coriander, Indian sauf. So there's a whole range of edible family in them, and these are the inedible ones. Okay. And as you know, the poisonous substances in homeopathy often make the best remedies. So keep that in mind. Always learn, and this is something I've learned from Arya sir, that you should know the stages of life and the constitutions to which any remedy is adapted. Now, unfortunately, cicuta is often disregarded as a specific remedy and it's just the convulsion remedy. But there is a lot to learn about the materia medica of this remedy. So it is definitely adapted. Am I audible? Can someone put a thumbs up? Sachin Mehta, can you? Yeah. So it's adapted to extremes of age. So to the children and to the elderly, and it's adapted to women. It has a distinct sphere of action on the mental and on the physical side. In the mental side, we often know these three words are very important if you want to remember cicuta. See, there are ways to remember materia medica. Either you can go into Kent and go on reading the long way of the entire paragraph. But the key take-home message of a cicuta mental state is a confused person, is a suspicious person, and is a person with absurd behavior. These three words are very important. If you know these three words, how confusion is related, as you know very well, the symptoms in materia medica. Post-epileptic attacks, they are confused. They don't know what happened. So Kent writes in great details. These people are clueless as to what happens. They suffer from a convulsion and they don't know what has happened. They don't know what has hit them. Okay, so this is very important, and this differentiates us from nux vomica. So cicuta is a very confused kind of personality. Also, cicuta doesn't know this from that, starts playing with toys, will see something lying on the floor, and an elderly person will start playing with those toys. This is what is written in a materia medica. So shows a great state of mental confusion. A very suspicious remedy, as suspicious as lachesis according to some authors. They cannot trust people, and this suspicion is at the level of mind and it is at the level of body. How do you see it at the level of body? In cicuta virosa convulsions, at the slightest touch, everything comes back. So they don't like anybody coming anywhere near them, anybody coming anywhere to touch them, and they jerk. So this is very classical. So there is a high level of suspicion at the mental level. And they have absurd behavior, which I have discussed with you, that they will play with toys, they will want to eat coal. This is very typical of cicuta. They are sad, they are lonely people, they keep whining, and they are greatly affected by sad stories. Now, this often reminds you of calcarea. A calcarea constitution, typically when you tell them sad stories, they get very deeply affected. It hits their heart, or phosphorus, they get very bothered. But this is there in the materia medica of cicuta. They are profoundly affected by sad stories. So don't forget this as an important ailments from. You will probably get this in pediatric case history, especially if you're listening carefully to what a child has to say or to what a mother has to say. In the physicals, we've got congestion, a lot of congestion. Typically, the face turns red. There is a disposition to grind teeth. There is swelling of the submaxillary glands, which is specifically mentioned, and it affects the areas of the cheek, jaws, and perioral. So all these areas of attack of a drug are very important to learn. It's extremely important that as a student of materia medica, these are the type of this is the type of way you should learn all your materia medica. What is the sphere of action? One word to remember cicuta, and right from Guernsey to Farrington to Kent to Boric, is the word violent. The word violent meaning everything is greatly exaggerated. So there are violent convulsions and frightful distortions. So when we're looking at epilepsy, you have all that typical jaw going one way, the eyes looking the other way, limbs going up and down. So this is called violent, frightful distortion. Okay. Uh, if you don't know what frightful distortion means, most of you who are on the younger generation, when I say younger generation, meaning between their 20s and 25s, you have these apps now which can make your photos. You take a selfie and then you can distort your picture. That's the kind of picture when you want to look at for cicuta. Okay. Then you have violent hiccups. So even the hiccups are violent. They're not just, they're like loud and very, very, very violent. Violent jerking of the head. So the throwing back of cicuta is uncontrolled. It's like a jerk. Violent, strange desires. When the person sees coal, they have this crazy desire to catch that coal and put it into their mouth. This may or may not be related to iron deficiency anemia. We don't know. But there is an abnormal, crazy desire to eat coal and chalk. So close to alumina, close to calcareous carb. Then there is a violent urge to urinate. So when the urge to urinate comes, a cicuta person cannot hold in. He just has to urinate. And the vertigo is also violent. So the word violent is common. So everything in cicuta is violent. Okay. And the strong general modalities of any drug, very important to learn, are worse touch in cicuta, even the slightest, worse jar, worse motion, and worse noise. Forgive my spelling mistake over there. And they are distinctly better by lying in darkness and distinctly better by rest. These modalities which are at the bottom are very, very true for the convulsions that you see in cicuta. Very, very true. And if you read the story of cicuta, then you'll know how all of this matches. So cicuta, unfortunately, has always got labeled only as an epileptic drug. Even in college, the only thing we get about cicuta is to write about the central nervous system affections of cicuta. Remember the downward direction for cicuta. Directions are very important in homeopathy, and a good homeopath, and in fact, just like Amit pointed out, look for these small symptoms. This is what helps you pick drug A from drug B. Otherwise, you will get lost. You will think, okay, now this is convulsions. Is this artemisia? Is this cicuta? Is this nux vomica? Is this trichinum? Is this cuprum? You have to study the symptoms of the patient very carefully. And very often it could be just a line said by a patient. It could be just a line said by a parent. There's the downward direction. So there's convulsions start from the face and then slowly it goes towards the hands. This is typical for cicuta. It is the absolute reverse of cuprum, where the convulsions start from the fingertips and then go upwards. So the small and minor differences extremely important. Dr. Boger, Dr. Boninghausen, Borick, Dr. Borick, they always have a lot of importance to the direction of symptoms. Like we know for Lidum, it's ascending. So these type of things are very, very important to learn and to memorize. There is always rigidity and backward bending. Again, very characteristic for cicuta. So as a student of Materia Medica, when you see this word backward bending, the next drug that pops into your head, backward bending. Backward bending ameliorates, I think, of Dioscorea. I'm not happy with this Zoom because I can't get to talk. Otherwise, I would have definitely asked these questions for remedies back from you all. Extremely important remedy for injuries. Injuries to the head, concussions, to the spine, and very, very interestingly, splinters, which they have written, which of course gives you a picture of tetanus. So for which homeopathically, cicuta is supposed to be specific. Very interestingly, for fish bones lodging in the throat, after which the patient complains of dysphagia. Very, very important. We sometimes forget cicuta because we don't revise this too often. Okay. Very important sphere. If you go to see every single homeopathic remedy that is a nerve remedy, also is always a skin remedy. So the role of neuroectoderm cannot be emphasized more. And that is why in homeopathy, we are always often talked about suppression of eruptions. Don't suppress eruptions. Don't suppress eruptions. There will be disappearance or metastasis of the disease force from the skin to the brain structure. And a lot of homeopaths have found this true in practice even today. So any remedy that is a nerve remedy also necessarily has to be a skin remedy, and vice versa, and vice versa. Okay. So the characteristics of the cicuta skin are honey colored scabs, thick yellow scabs on the head and face. So the area affected is very important. Uh, it's not that it comes everywhere. So you should know the preponderance of areas. So if you go into Fatak repertory, you will have umbilical area, you will have back, you will have scapula, you will have behind the knees, you will have eruptions, elbows, you have this in Kent. So you must study materia medica properly. So when cicuta has a sphere of action, it is the head and face. And typically on the face, it's the cheek, the mandibular area, which also gets these crusty eruptions. Kent very specifically mentions about troubles after shaving. So when you read that, you could remember that this could be a very, very important remedy for folliculitis, for impetigo. What's also mentioned in materia medica is that there is no itching, which is a characteristic of this remedy. So eruptions are there, but no itching. So when you see something like this, then you should remember cicuta. Likewise, in materia medica, we have itching, but no eruptions. And the remedy is dolichos. So these small red flag symptoms, which are italicized somewhere or the other, should be part of your daily or monthly materia medica revision. And you keep increasing your list. Now, in a book by Dr. Bhanja, which is a very useful materia medica book that I use, he has very clearly listed 2 remedies at par with cicuta, which I think most of us, and especially those of us who are in practice, see all the time, that to have a war with cicuta, you have to rule out antimony crude and you have to rule out mesarium. Now, mind you well, antimony crude and mesarium are far more detailed in terms of their provings, in terms of their use in homeopathic practice. But do remember to keep it at par with cicuta. So antimony crude also has yellow crusted eruptions, but they are painful and they detach easily. So they can be peeled off easily. I've seen this in practice, literally. They literally can be peeled off easily. You get like a fresh layer of fresh skin coming off. Whereas mesarium has typically the crust around the mouth and cheek. And for those who attend Habu Sir's OPDs and his lectures, which he has taught us, he always tells us the area around the bridge of the nose is a typical specific area for the action of mesarium. All right? So please keep this in mind. Now, the next 4 slides are what I do with cicuta in my clinic. I'm sharing this because I have seen this in the last 15 years of practice. So when I share something like this, it is something that I have seen in clinic repeatedly. I am not putting them with some cases because it's hard for me to do that in this short lecture that I'm taking. But I do remember cicuta vividly, as will Aditi, because we used to attend Dr. UCK's clinic in Sanjeevan. And we were in our 2nd year. And I remember a case of chronic recurrent glossitis and aphthe. And very, very troubled person, young boy actually, and he was extremely troubled. And the history was taken by the students, and UCK sir, that is UC Kulkarni, just took the whole case paper, looked at the history, and then he just asked him, "Bolta na worse hoto hai ka?" Meaning, when you talk, does it get worse? And he wrote cicuta 30, 3 doses and SL. And next 15 days, when the patient came back, he was 70% better. And here we are scouring through borate and through this and through that. And what was the clue to cicuta? And when we asked sir, he said, "Go read." For people who know that, go read. So I do remember this, and it stuck into my head for a long time. And I struggled with a case of recurrent glossitis and aphthe, who had taken the works from many doctors, was applying quinocort all the time. And this was 2004 in my practice. And just casually said, "I can't talk all the time. And every time I talk, this gets worse." And my brain went back to 1997 and I said, "Let's try cicuta." And I gave cicuta to this person and he improved like magic, absolute magic. So after that, I have seen cicuta work very, very repeatedly when you get this symptom that was talking, and at the edges of the tongue, you get ulcers. So it seems to have a definite affinity to the sides of the tongue that is mentioned in books. But the other reason which I figure could be is the lack of coordination. Being a nerve remedy, the jerks, probably the way the teeth are coming together or the tongue is unable to come correctly is probably the reason why cicuta could be helping in these cases. So I'm sharing this. So if you have cases of aphthe that don't get better or keep recurring and you have not tried cicuta, and if you've got something like this, do consider using cicuta and let me know. It would be interesting. I have often seen this remedy work very well for people who wake up with very tired jaws. There are a lot of people who get up with that feeling that this is hurting a lot. So sometimes they say it's sinusitis, and this is where clinical examination matters. So you should know how to examine, press where the maxillary sinuses are and actually confirm what is hurting. Very often it is just a tightness or a spasm of the masseter muscle, and that gives enormous pain. Very often it could be the temporomandibular joint that is hurting. So often you will see that these people are teeth grinders. They will not know that they are actually grinding their teeth or they're clenching their teeth in their night. So they get this horrible, horrible pain. If you take their homeopathic study more deeper, just when somebody is a teeth grinder, especially when he's an adult or a tooth clencher, we can apply that there is a lot of mental suppression. And we can get out a remedy or the true reason behind it by digging a little bit into their mental sphere. I mean, these are shortcuts in homeopathy. And often you find they could be Staphylococcus aureus, natrum mors, or causticum, which if you use in higher potencies can eventually cure these cases. But cicuta does an amazing job in giving relief to that pain that comes because of this spasm of the muscle. Another very, very important place that I have used cicuta repeatedly and with excellent results is for coccygodynia, which is mentioned in the books, and they have mentioned coccygodynia after parturition, or lower back pain, wherever the patient tells you that he fell down patak on his buttock. Okay, when he has slid off a slide or fallen on the staircase and he has hurt his tailbone or that L4, L5 and the coccyx region very, very badly as a blunt blow, cicuta is in fact the #1 ranking medicine. Okay, so we have often seen that arnica works partially, ruta works partially, hypericum gives relief. People typically tell you as long as they are taking the pills, they are feeling sort of better, but it's not really going away. And they typically use that word that something moved in my back when that jerk happened. And this jerk can be a PMT bus that somebody has tried to climb into and it suddenly moved and then they could not grasp and they had to jerk. This is an indication for cicuta. It is like a sudden harsh movement to your vertebrae. And you should remember cicuta because the nerves are hit with that jerk. And the potency that I find here is not the 30 or 200. I find you need to use the 1M or the 10M infrequently to give best results. This is what I do. I forgot to mention the potencies that I use for the mouth ulcers. It's normally 6 or 30. No higher than that, it gives good results. But when it comes to the affection of these nerves, I find using the 1M or the 10M infrequently, like maybe every 7 days, starts giving amazing results and patients are actually free and then they come back forgetting about that they ever had this problem. And that should be the aim of giving them good homeopathic treatment. I deliberately did not talk about its utility in epilepsy because I think that's exactly what this drug is so famous for. But yes, do remember that it is one of our most important drugs for grand mal epilepsy. Modalities are worse night. They get frightful distortions. There is frothing. There is no recollection of the attack. And they are extremely exhausted between two attacks. So they are very, very quiet between two attacks, which is in sharp contrast to nux vomica, which will probably have everything of cicuta, but they are extremely irritable between two attacks. And these small minor differences are put down by the great masters, and you have to memorize these to know when to prescribe cicuta, when to shoot with nux. Both are at par. And another important remedy that stands amongst all this is ignatia. Again, very, very close. So do remember to do strong differential materia medica of cicuta for epilepsy. Now, the other thing that cicuta, if you read in materia medica, it's a strong action on the neck, all the rigidity, the throwing of the neck backwards. And when you read this, I often thought that since such a strong sphere of action here, why can't this be an important remedy in spondylosis? Because if you see people with chronic spondylosis, the one who use the collars, etc., they keep doing this all the time. They have this habit of lifting this muscle, that muscle, turning. And we use Rustox, we use Ruta, and the results may be very good in some patients. I mean, this is the funny part of homeopathy. You'll give that one person Rustox because you'll see he's restless and he will have amazing results, like he gets okay in 15 days. And then there'll be someone who's taking your Rustox for 6 months and every time he's coming back to you, but the complaint hasn't really gone. That's where you need to reanalyze. So for me, in Pune city, we know we are blessed and proud to be the city of potholes. And everybody who drives a two-wheeler has to go to dump. And everybody is so possessive about not leaving the laptop bag down. And most people don't like to carry the two-strap laptops. They carry the one sling bag. So people who do this already have a lot of muscle imbalance. And to that, when they go through these bump holes, they suffer with a lot of spasms of their neck muscles, the entire musculature. And I have found that cicuta is one of the biggest remedies that gives amazing results to relieve the spasm. I mean, full credit to Macphos, full credit to Bryonia, full credit to Simicifuga. There is a whole array of remedies that could work here. But cicuta often gets neglected because it has always been put in that box of epileptic. In fact, probably there will be some people who say that no, you can't use an epileptic remedy for a muscle spasm. But then that's not homeopathy. Then that's not homeopathy. It definitely has a role, and I do this. I have been using it in practice, and hence I am sharing what I do. Again, over here, the potency is 1 m or 10 m infrequently, once a month, once in 15 days, depending on the case. It's a very useful remedy for acute hiccups, but the difference is the intensity is crazy. That's why the word violent. It just does not stop. It just goes on and on and on, and it is like it frightens people in the house. Frightens them enough for people who have to rush to hospital to do something about their hiccups. This is one of those places where you can try cicuta as a blind prescription. This is a very memorable case I've just put down typically for you because another homeopath tried to treat this 4-month-old baby. He was hospitalized because of hiccups, and he was a baby on bottle feed. And as usual, when they are bottle fed, every complaint can be attributed to bottle feeding, that you fed too much, you fed too fast, etc. But the hiccups were not stopping. And with every hiccup, the child was arching in the typical Dhanush position, the opisthostonis. The earlier homeopath had given Ignatia because the mother apparently constitutionally and otherwise also, even when the kid got this, was in that typical Ignatia state. Then tried Macphos, then tried Hyoscyamus. There was no relief. Interestingly, this child had eczema of the skull, a typical crusty eczema, kaput, what they call. And some topical application was put and it had vanished. It had vanished a week ago. And just hearing that and seeing the way this thing, I gave 1 m 3 doses and I told them to give it in mother's milk. This woman was lactating, but she kept feeling that the child is not getting enough, so she had put the child on top feed. And that was it. Barely after the second dose, everything vanished. So this is the magic of homeopathy. I mean, it has to be done, it has to be seen, and then the results are all theirs. Cases like this can bring great glory to homeopathy. It's amazing how it works. So I don't know whether it was really suppression of the eczema that caused this child to get this irritation of the diaphragm, or basically best that it was a perfect case of cicuta that fitted and that's why it got better. So anyway, return of the eruptions as to say that yes, the cicuta brought the eruption back and then the case got okay. No, nothing like that happened. This child just got beautifully okay within 15 to 20 minutes of the first dose. So I mean, for me as a doctor, that felt very nice. It's a very useful remedy for fasciculations. I've experienced this myself. Many of you know I suffer from chronic migraines, and sometimes after migraines you'll end up with these twitches that you get around your eyes, and you have a muscle that goes flutter, and can be a very annoying symptom for a patient, especially when you're experiencing it yourself. It just constantly goes on. So in such cases, when you're seeing them for the first time, they should be assessed neurologically. You should rule out that there is no pathology behind the fasciculations. And if it is a functional thing and no clear modalities, nothing are there, the only thing people will have for this is that when they think about it, they get it more, or when they're drinking coffee, it happens more. And oxalic acid is not the remedy for this. Cicuta works brilliantly. Few doses of 30 or 200, job gets done. That's how easy and simple it is, So I'm coming to the end of my lecture. I can't see anybody, so I don't know everybody's reactions. Please continue reading one remedy a day and two on Sunday. Spread the joy of healing with homeopathy. Please share your successes and your failures. Don't get bogged down by the concept of small and big remedy. I mean, just now, Amit's case of Ethusa is perfectly what this line is written for. The right remedy at the right time in the right patient is always going to give you results. That's all I want to say for now. Thank you.
Thank you, Sachin. That was a very informative and great talk. Just like you said that one remedy a day and two on the weekend, I have to tell you that you have to take one remedy every week for us, if not two. So I'm going to be pushing you again and again. So think of what you're going to do next for the next 4 to 8 weeks, because you'll have us on your back. Thanks so much.
Thanks.
Dr. Mehta?
I'll start. Okay. Thank you. First of all, thank you, Amit and Sachin. You both took so interesting lectures that I can see all the crowd is still waiting for my lecture. I am happy to see this. Now, I teach in college, Bharati Vidyapit. One of the most common query with the student is, sir, it is very difficult to take out cases. In case of the history, in cases of children, particularly when the child is 6 months to maybe 5 years age. Amit, I am okay, no? Audible properly? Amit? Okay. So many students face this difficulty that how to take detailed history, how to find out constitution in a child who is just maybe 6 months, maybe 2 years, 3 years, or somebody who is less than 5 years can't give proper history. Mothers are also very difficult to give history. Then what is to be done? This was never a problem with me because I've learned with Habu sir, and Habu sir's analysis of the patient starts as soon as the patient comes in. This is what I have read in Nash. Nash says a skillful observer can often see the picture of the remedy of the patient as soon as he enters his clinic without asking a single word. In Lycopodium, Nash says without asking a single word to the patient, you can make out the constitution of the patient. How this can be done? This can be done only by perfect observation. This is what I have learned from Habu sir.